Parkinson's disease was first described by a British physician, James Parkinson, in 1817. About 100,000 Canadians, 1 million Americans, and more than 6.3 million individuals all over the world are affected with this disabling condition. Although most people affected are over the age of 55 years, it has been known to occur in young individuals as well. It is a neurodegenerative disease and involves the loss of brain cells capable of producing dopamine. Dopamine is a neurotransmitter, a substance involved in the transmission of signals between the nerves in certain parts of our brain. Dopamine helps facilitate the movements of our body. The deficiency of dopamine results in slowness of movements of our body, which is one of the major symptoms of Parkinson's disease. Although Parkinson's disease may be a complex condition with many implications on your life, it can be managed well with medications, proper advice, and support. There is no cure for Parkinson's disease, but the patients can live with the disease for many years. The major symptoms of Parkinson's disease include slowness of movements in performing activities of daily life, a tremor which usually starts on one side of body, in hand, arm, or leg, while the affected body part is in the resting position, stiffness, balance problems, shuffling, and slowness in walking. There are many other symptoms of Parkinson's disease which become apparent as the disease progresses, such as reduced facial expression, drooling, difficulty turning while walking, freezing of gait, falls, stooping of posture, fatigue, small size handwriting, constipation, sleep disturbances, softness of speech, swallowing problems, memory and cognitive dysfunction, depression, anxiety, pain, numbness and tingling, urinary bladder problems, sexual dysfunction, dry skin, as well as postural dizziness. Parkinson's disease is diagnosed by history and physical examination conducted by a physician. There are no laboratory tests that can be used to confirm the diagnosis of Parkinson's disease. A neurologist who specializes in Parkinson's disease may observe you for a period of time to make sure that the symptoms are consistent. Medication and rehabilitation are the primary treatments used for Parkinson's disease. As the disease progresses, the quantity and frequency of medications need to be adjusted. The medication used for Parkinson's disease may have some side effects as well. The commonly used medications for Parkinson's disease include amantadine, monoamine B oxidase inhibitors including salicyline and razeginine, dopamine agonists including pramipexole and ropinirole, levodopa carbidopa, and levodopa benzoate. Anticholinergic medications such as trihexyphenidyl or benztropine may be used in some cases. Rehabilitation treatments include physiotherapy, which helps mobility and balance problems, speech therapy, which helps with speech and swallowing dysfunction, occupational therapy, which focuses on easing everyday activities. Exercise could also be very beneficial. In selected cases, surgical treatments may be used. You can help to improve your treatment by making sure that you have the correct information about your condition. Seeing your neurologist on a regular basis is also important. Some treatments may work better than others. Also, keeping track of changes in your symptoms is important. This will help you indicate if the treatment needs to be modified. Parkinson's disease progresses differently in each person and requires a specific approach in every individual. Exercise and healthy eating are important. Walking is a simple form of exercise which can be done every day. A physiotherapist can help you find exercises that are appropriate for you. Incorporating fiber and fluid in your diet would help constipation, which is often associated with Parkinson's disease. Joining a sport group is also very helpful. These groups meet regularly, invite speakers on Parkinson's disease, and may also offer you exercise program as you join them. Parkinson's disease is a disabling disease, but you can adjust the activities of daily life to your level of ability. Parkinson's disease is not a normal part of aging. It is a medical condition which needs to be managed by a neurologist. A small fraction of cases of Parkinson's disease may be hereditary in nature. Parkinson's disease is a treatable condition, and you can aid your treatment by taking your medications as instructed by your neurologist and keeping a positive attitude. Depression can also be a symptom of Parkinson's disease. Make sure to talk to someone if you feel depressed.